Thank you for joining us for the second part of MHS's TNR program webinar. We're going to begin with guidelines for surgical drop-off. Once you have scheduled your appointment for spay or neuter, there are some guidelines you must adhere to in order for MHS to sterilize your cats. All cats must be in a live trap. No exceptions will be made. There also may only be one cat per trap. Again, no exceptions will be made. The certified caretaker must be present to drop off and pick up your cats. Caretakers will sign surgical consent forms for each surgical event and each animal. A sample can be found in your handbook. It is important for you to be available at all times on the day of surgery in case we need to reach you for an emergency. If we cannot get in touch with you, the doctor of veterinary medicine will proceed as they see fit. You must pick up all cats by the end of the day. There will be no exceptions. Failure to follow these guidelines may result in immediate program dismissal. Once you have picked up your cats from our veterinary center, please follow these guidelines when you first get them home. Cats are given long-lasting pain medication to help with recovery. You will not be sent home with any medication to administer. Cats should stay in live traps in a warm, quiet recovery room for 24 to 48 hours following surgery. Keep the trap covered and talk quietly and calmly when checking on the patient. Food may be offered later in the evening, the same day of surgery. Use a tongue depressor to insert food through the bars if no dividers are available. It is normal for cats to disappear for several days following surgery. Most return after, but some do not. Additional guidelines for post-operative care can be found in your handbook. At times, we are unable to sterilize a cat. During the initial consult with your veterinarian, you will also have the option to purchase some additional services. Answers to further questions can be found in your TNR handbook. Surgical information. Procedure services included are sterilization, meaning spay or neuter, the rabies vaccine for cats 4 months of age and older, and a left ear tip. As with any surgery, there are risks. The Michigan Humane Society takes the responsibility of surgery very seriously. Post-surgical risks and complications can include infections, extended recovery times, morbidity, and mortality. The Michigan Humane Society has a partnership with the Tomahawk Live Trap Company. Tomahawk offers discounted traps to participants in the MHS TNR program. Please note, the Michigan Humane Society does subsidize a portion of the cost of the trap for certified TNR caretakers. All traps must be ordered only by phone. They are shipped directly to your home, and divider forks are also available to you at an additional cost. Cleaning and sanitizing the traps between each use. Use dish detergent and a hose. Spray the entire trap to remove any remaining food, dirt, urine, and feces. Sanitize the trap with a 30-to-1 mix of water to bleach, so 1/2 cup of bleach to every gallon of water. Saturate the entire trap and let sit for 10 minutes. Thoroughly rinse the trap and allow it to air dry. Thank you for watching Part 2 of the MHS TNR webinar. Please proceed with watching Segment 3, live trapping information, at your earliest convenience.